Hello, it's me again, Earl from the Learnanatomy team. Hope you're all well and you've had a good week. And to all of those who have been writing in, thank you. We've really received some really good and positive comments about the work we're currently doing. And my colleague Jane has done some fantastic work in producing a series of posters. So we've got the Veggie Man one, so those will check out our website because soon they'll be available for order. And we are busy planning a lot of workshops that are coming up, so we're really excited about that. Learnanatomy, we're trying to make it fun, we're trying to engage with colleagues and students and really bring learning of anatomy to life. But today Sarah wrote in and said, Earl, I'm studying, I need a little bit of help just revising some of the bony features and bony anatomy of the hip. So today I'm just going to do a very quick video take to help Sarah revise and revisit some of the key bony landmarks and bony anatomy of the hip. So I hope that you find this video of use as well. So once again, my little friend Boris Jr. is here to help us. So we started out a few weeks ago doing a video talking about the anatomical stance or anatomical pose, and that was little Boris standing up straight, everything facing forward. And that's important because if we think of the role of the human body, we have the cranium balanced on the vertebral column. The vertebral column is not straight, it curves in a normal way. And then we have a lot of our weight-bearing role aligning with the hip. And then if we look at the structure of the appendicular part of the limb or lower limb, we notice that the femur, the thigh bone, is the thickest and the strongest bone in the body. It's not a straight bone, it bows, it comes inwards towards the midline. That plays an important role in ensuring that weight is then channeled onto the next strongest bone in the leg, tibia, the more medial bone, and then that weight comes onto the posterior aspect of the foot, the calcaneus and talus. So that's important in terms of just thinking about the bipedal nature of man. Man stands on two legs. Remember the word pedis referring to foot. So that's why we have pedals, for example, on a bicycle, or pedicure. So we are bipedal. Man has evolved to stand up straight. So if I now bring in Boris Senior and look at his bony anatomy, we can see that's a lot larger than Junior. But what we're really focusing on now is thinking about the anatomy of the structures that make up the pelvic girdle and the thigh itself, and how that comes together to form the joint that we know as the hip. Remember that we've got two important girdles within the human body. We've got the pelvic girdle attaching the lower limb to the axial part. The axial part, as a reminder, is the cranium, the vertebral column, the sternum and the rib margins and the rib cage. Appendicular part is everything that attaches to the axial part. Remember, appendicular from the word appendage, it hangs on or attaches onto it. But we've got two girdles, the pelvic, which helps the lower limb attach to the axial, and the pectoral or shoulder girdle, which allows the upper limb to attach onto the axial part. So those will be the focus of future videos, but today we're really just trying to go through some of the key bony anatomy of the hip and pelvis. So the pelvic girdle, or the pelvic basin, as we're looking at now, is made up of three important bones. The biggest bone is called the ilium. And it's important you spell it right, because this bone is spelled I-L-I-U-M. If you spell it I-L-E-U-M, you are referring to a part of the colon, and that refers to a different structure within the human body. So the ilium is the main bone of the pelvis, this tall bone here, and it has a crest at the top, so you can rest your hands on your iliac crests. In the front, how do you know which is the anterior part? The anterior part, just like the back, as we'll point out, has got two little spines in the front. The first spine that you can feel in the front of your hip or pelvic girdle is called the anterior superior iliac spine. It lies on top, and underneath that we've got the anterior inferior iliac spine. At the back we've got the posterior superior iliac spine, and posterior inferior iliac spine. So the back part is quite roughened part, as you can see here, and that's important because the vertebral column, the last part or the lower part of the vertebral column, the sacrum, articulates very cleanly, and it's a very tightly packed joint here at the back, and that's called the sacroiliac joint, the SIJ. And in childbirth, that joint doesn't move a lot. It's quite a stable joint, and it plays an important role in weight bearing and stability of the pelvic girdle. So the lower limb is more stable than the upper limb. So in the body, we're always working through these ideas about stability and compromise for mobility. So the upper limb moves more but is less stable, for example the shoulder, where the hip is more stable but is compromised in terms of what it is capable of doing in terms of motion. So, ilium. Then the part that we sit on, the sitting bones, ischium, and then the bones that join to form the front of the hip or pelvic part is called the pubic bone. And there's a cartilaginous disc that sits in there. And that disc is important, especially during childbirth, so that the pelvic bones can move apart in order for natural childbirth to occur. That is a cartilaginous joint, and if you look back at the video that Jane did, you will see the different classifications of joints. So, once again, just to help you out, the flat portion of any bones onto which muscles will attach is called a fossa. So this is called the iliac fossa, an important muscle that helps to flex the hip, attaches on there, called the iliacus. Then an opening in bone is called a foramen, and this part is called the obturator foramen. Then we've got a little bridge of bone coming from the ischium to the pubic bone, and that little bridge is called a ramus. So this is the pubic ramus, little bridge of bone there. Looking at the back, this part that we sit on, this is the posterior part. This is called the ischial tuberosity. Okay, a process of bone that enables us, when we sit down, that's exactly what we're sitting on. There are a number of lines that we can see running across on both sides. Those are called the gluteal lines, onto which some of the gluteal muscles will attach. This little notch here is called the greater sciatic notch. An important nerve called the sciatic nerve, as we know it, passes through there. But what's important is that the sciatic nerve doesn't actually exist. We just know it as a nerve. It's actually two nerves. It's the femoral nerve and the peroneal, common peroneal nerve. They come out and then travel and supply the lower limb. So it's actually a bundle of nerves, but we all know it commonly as the sciatic nerve, and we know that when we get sciatic pain, we get referred pain traveling down the thigh. And what can happen, we've got tight muscles deep within the gluteal part which help to externally or laterally rotate the femur. So it does that, turns it outwards, and in so doing they can become tight and they can compress the sciatic nerve as it goes from the vertebral column through that notch moving into the thigh, and that's when you get your sciatic pain. And the muscle that is mainly involved with that is a muscle called the piriformis, but we'll do that in another video. So the key anatomy for the hip is that we've got three important bones again: the ilium, the ischium and the pubic bone. All of those bones fuse to form the socket of the hip, and this little socket is called the acetabulum. Acetabulum. It's formed by the fusion of all these bones. Now this joint is known as a synovial ball and socket joint. So if we think of the ball is actually the head of the femur, and the socket is formed by all three of these bones fusing or joining. It's multi-axial, in other words, it moves in multiple ways, similar to what the shoulder joint does. So we can have flexion and extension in a sagittal plane, And that flexion and extension in a sagittal plane, okay, is important to actually aid, either with the knee bent or with the knee straight, how this hip moves. We then can have abduction, we can abduct our thigh or adduct our thigh, okay, and that's occurring in a frontal plane. And then we can rotate internally, externally, and that would be across a transverse plane. And there's also a little bit of circumduction that can happen within the joint itself. So lining the inside of that socket, the capsule, we've got a cartilaginous lip, and that lip is known as the acetabular labrum. Labrum means lip, and there's a little lip that helps to deepen the socket. Then we have the head of the femur, and there's a little hole right in the head of that femur, and a hole is called a fovea. And it's on the head, so think of a cap that you wear on your head. So that little hole is called the fovea, spelled F-O-V-E-A, capitis. And inside there we have a ligament that pulls the head of the femur into the socket. So there's the head, that's the neck. This chunk of bone that you can feel on the lateral outside of your hip is called the greater trochanter. And a lot of students confuse this as the head of the femur. It's not. It's the greater trochanter. The head articulates with the socket. Down here we have the lesser trochanter. We've got the intertrochanteric line and crest on both sides, anteriorly and posteriorly, and two necks, anatomical neck and surgical neck, which is where surgeons may cut through in order to replace the hip. And those are the key proximal markings that we find on the femur. So really we're looking at the proximal articulation of the femur with the socket formed by the three bones that make up the hip or pelvic girdle, ilium, ischium, pubic bone. So in your study, it's important that you understand these bony markings, because the bony markings are important not only for where muscles attach, but you also find that in order to strengthen this joint and the capsule of the joint, we've got a number of ligaments that extend between bones. For example, the iliofemoral or the ischiofemoral ligament or the pubofemoral ligaments. And those are really important to stabilize the head and make sure that that capsule of the joint is stable, so that the hip doesn't translate in ways that can cause it stress. So what you don't want is the head of the femur popping out of the socket every time we move. And in order to ensure that that doesn't happen, we've got a suction effect pulling the head into the socket, and the socket and the capsule around this joint becomes more stable with strong muscles, ligaments and tendons of muscles that are helping to ensure that the bipedal nature of man is in an effective and efficient way. So I hope that's been of use. If there's anything I've left out or anything you would like to inquire more about, please feel free to mail us. But I hope that you found that as a good start to helping you better understand the importance of the osteological features in and around the hip. Osteology, remember the word os, O-S, pertains to bone. So wherever you see the word os, you really are thinking about bone, like osseous tissue or interosseous, between bone. Osteology, the study of bone. So hopefully that has been of use. Until next time, from myself, Earl, and my little friend Boris, looking forward to receiving your mails. Please check out learnanatomy.uk. A lot more is going on. We are really building a wonderful base for you and a resource that will hopefully enable you to achieve your best grades.